नमस्कार, मैं डॉक्टर मनोज सोनी, नवजीवन मल्टी स्पेशलिटी हॉस्पिटल हिसार, हरियाणा. Today we will talk about liver cirrhosis. What is the liver cirrhosis? Cirrhosis is the late stage of chronic liver disease. It is characterized by progressive fibrosis. There is scarring of liver tissue, nodular regeneration, and loss of normal liver architecture and function. What causes liver cirrhosis? The common causes of cirrhosis include chronic alcohol use, that is alcoholic liver disease, chronic viral hepatitis, hepatitis B and C, non-alcoholic fatty liver disease, autoimmune hepatitis, biliary disease, primary biliary cholangitis, genetics and metabolic disorder. For example, hemochromatosis, Wilson disease, and last is drug and toxin induced injury. What are the symptoms and complications of cirrhosis? The symptoms are fatigue, weakness, loss of appetite, weight loss, jaundice, abdominal distension, itching, confusion, that is hepatic encephalopathy. Among complications are portal hypertension, ascites, variceal bleeding, hepatorenal syndrome, hepatocellular carcinoma, and spontaneous bacterial peritonitis. How to diagnose liver cirrhosis? There is most important thing is clinical history and physical examination. Blood test, liver function test, imaging, ultrasound, CT scan, MRI that may show shrunken and nodular liver. Transient elastography, that is fibroscan, it measures liver stiffness. Endoscopy to look for esophageal varices. Liver biopsy if diagnosis is not clear. When do I need to have a liver biopsy? A liver biopsy is recommended when the cause of liver disease is unclear, non-invasive tests are inconclusive, there is need to grade or stage the extent of liver fibrosis, suspected autoimmune or metabolic disease. What are the substances which causes liver damage? That is alcohol, acetaminophen, paracetamol, certain antibiotics, antifungal, hepatic supplements, that is kava, comfrey, industrial chemicals, vinyl chloride. What quantity of alcohol consumption can lead to a liver damage? Risk increases with men more than 30 to 40 gram per day, women more than 20 gram per day. Chronic heavy use over 10 years significantly increases risk. When do complications arise after I start drinking? Complications usually occurs after 8 to 15 years of chronic heavy alcohol use. However, in some even shorter duration can lead to alcoholic hepatitis or early cirrhosis, especially with genetic predisposition and coexisting hepatitis. Does hepatitis C causes liver cirrhosis? Yes. Chronic hepatitis C infection causes progressive inflammation, including a fibrosis and eventually cirrhosis in 20 to 30% of cases over 20 years. What causes hepatitis C? Hepatitis C is caused by HCV, hepatitis C virus. It is spread through contaminated blood, IV drug use, unsafe transfusion, needle stick injuries, unprotected sex, mother to child, that is vertical transmission. Can vaccination prevent hepatitis C? There is no vaccine currently available for hepatitis C. Prevention relies on avoiding the risk factors, especially blood exposure. What are the treatment of liver cirrhosis? Treat the underlying cause. Antivirals for hepatitis B and C. Abstinence from alcohol. Manage NAFLD through weight loss. Medications. diuretics for ascites, lactulose for hepatic encephalopathy, beta blockers for variceal bleeding prophylaxis, endoscopic intervention for varices, paracentesis for ascites, liver transplant in decompensated cirrhosis. What are the best way to manage cirrhosis? That is, avoid alcohol and hepatotoxic drugs, vaccinations, hepatitis A and B, influenza, pneumococcus, nutritional support, low sodium, adequate protein, regular follow-up and imaging, ultrasound every 6 months for hepatocellular carcinoma screening, monitor and image complications, treat the underlying cause aggressively, consider transplant evaluation if decompensated. Thanks.